Good morning, everyone, and welcome. Good morning. Welcome to La Rabida Children's Hospital. My name is Rola Swice. I'm the president and CEO here. We're so honored to host President Preckwinkle here today to announce and celebrate $25 million in grant funding for programs to not only respond to, but prevent gun violence. With these grants, we can better support those at risk for and those that are survivors of gun violence. At La Rabida, our Chicago Child Trauma Center's mission is to provide high-quality, free, trauma-informed services to children and families impacted by trauma, who often have multiple traumatic events or complex trauma and are residing in under-resourced areas. With these new funds, our Chicago Child Trauma Center can further address the issue of gun violence, its traumatic effects on children, youth, and families, and the lack of trauma-informed mental health providers of Southside Chicago and South Suburban Cook County. Thank you, President Preckwinkle, and to the Cook County Justice Advisory Council. We're thrilled to be part of such a distinguished group of organizations working to build a brighter future. Ladies and gentlemen, please welcome President Preckwinkle.
Good morning, everybody. Good morning. I want to thank you, Ms. Weiss. It's a pleasure to be here today in this beautiful space overlooking the lake. I want to start by thanking the Cook County Justice Advisory Council, our agency that administers our grant initiatives. Avik Das and his team are here. Avik, thank you so much. We're grateful. All right, I got a long list of people to thank. I also want to recognize Kiwana Bell, Assistant Secretary of the Illinois Department of Human Services, Office of Firearm Violence Prevention. Thank you, Kiwana. The state of Illinois, IDHS, and Ms. Bell are key partners in our collaborative approach to addressing gun violence. Finally, I want to thank and recognize all of the grant recipients here today. We're proud of the work you do, proud to walk alongside you, supporting the critical work you do in your communities. We're here today to announce $25 million in grant awards under two grant initiatives, Cook County Community Violence Intervention Grants and Wraparound Services for Survivors of Gun Violence. These grant initiatives are complementary. They're designed to strengthen and sustain our community safety strategy by reaching and supporting two key groups of residents, those most at risk of being involved in a shooting and those who are survivors of gun violence. This approach is strategic. We're working to ensure vulnerable residents can access the services and support they need. Not only is it the right thing to do, but it helps build safe communities we all want to see. These investments recognize that safety is a community challenge. When someone gets connected to a CVI program that leads to stability and opportunity, it's a win for the entire community. When someone who has survived gun violence receives the support they need to heal, they become a cycle breaker. These small victories add up, making our communities more safe, healthy, and prosperous. Right now, we're starting to see the impact of investment in community-based solutions to gun violence. During the pandemic, unfortunately, we endured a tragic nationwide spike in gun violence. In 2021, Cook County saw over 1,000 gun homicides. It was a level of loss we hadn't experienced since the 1990s, more than 30 years. Many among us are still grieving, healing, and rebuilding their lives. In 2021, local leaders came together to collaboratively respond to gun violence, forming the Government Alliance for Safe Communities. This alliance has helped Chicago, Cook County, and the state of Illinois align, strategize, and maximize the impact of federal COVID-19 relief funding. Together, we responded to the gun violence crisis with historic investments in violence prevention and community violence intervention programs. Over $350 million in public funding was invested in community safety. In the last 3 years, Cook County alone has awarded $100 million in grants via our Gun Violence Prevention and Reduction Grant Initiative. Now in 2025, we're at a different place. So far this year, gun violence homicides in Cook County are down by 35% from 2024. They're down 45% from 2021. The historic investments in community safety we've made over the last 3 years are making a difference. It's important to acknowledge that the impact of funding is still being studied. Reductions in violence are likely caused by many factors. But it's a fact that researchers, experts, and people from the communities most impacted by gun violence agree that evidence-based approaches, like CVI, are effective in reducing violence. That's why we're continuing to invest in these approaches. Residents who are at risk or directly impacted by gun violence must be able to access critical programs and services. In closing, I want to acknowledge once again and recognize the awarded organizations. You're navigating a hostile federal landscape while providing life-saving services to the community. You're rising to the challenge of building peace in your neighborhoods. You're providing vital support to our most vulnerable neighborhoods. Thank you again for your service to the residents of Cook County. And now I'd like to ask Kiwana Bell, Assistant Secretary of the Illinois Department of Health Services, Office of Firearm Violence Prevention, to the podium. Thank you.
Thank you, President Preckwinkle, and thank you, La Rabita, for inviting us here today, and thank you to my colleague, Avik Das. I'm Kiwana Bell. I'm the Assistant Secretary of the Office of Firearm Violence Prevention at the Illinois Department of Human Services. And I was just thinking to myself before I got here, I spoke at the last conference a few years back when the JAC announced the awards, but I was speaking as a grantee. And today I'm speaking as Assistant Secretary of an office I'm very grateful and honored to lead. The Office of Firearm and Violence Prevention was established by Governor Pritzker in 2021 through the Reimagined Public Safety Act. Through RPSA, and the office has been able to invest over $300 million in the last 4 years in programs across 42 communities throughout the state of Illinois, including 30 in the city of Chicago and Cook County areas. And those awards have been done through almost 200 different community-based organizations across the state, which I'm very proud of because we understand that violence is very dynamic and that we need to have hyper-local strategies to address these violences. So we're very honored to be able to invest across the state through many of the local organizations who are also here today. So I see many of our grantees here today, so I'm very excited. That $300 million included $250 million in ARPA as well as some state funds. And now that ARPA has sunset, we are committed at IDHS to continue the sustainability of these programs because we know how critical they are for our communities. But we can't do it alone, right? So I'm so honored today to not just represent the state of Illinois, but also to stand here as a partner in the Government Alliance for Safe Communities, which we also are known affectionately as the GASC. And not gas, but GASC with the at the end. But you know, this collaboration is really unprecedented to see the city, state, county partners all coming together to align public dollars so that we can maximize the impact of these dollars. We align on streamlining even the funding process because we understand that many of our smaller organizations have capacity issues that are not allow them to write and rewrite grants. So we came together as this alliance to streamline, to coordinate, and to maximize these efforts so that there will be sustainability going forward. Very excited about that. Now, out of the nearly 200 grantees that we fund through IDHS, around 70 or so are first-time state awardees. So we recognize as GAS that capacity building is another issue that we should align together. And so we're rolling out a new capacity building effort where we are combining resources, aligning resources so that we can provide anchor organization to provide capacity building services to those grantees that we have. So very excited about this partnership, very excited about the success that we've had so far and the sustainability that we've been able to achieve post-ARPA and that we continue to work for. So congratulations to all the grantees. We look forward to all of your continued success as we all work together to fight against gun violence. Thank you. And it's my pleasure to bring my esteemed colleague, Avik Das, to the podium.
Good morning, everyone.
Good morning.
My name is Avik Das, and I'm the Executive Director of the Cook County Justice Advisory Council, serving under the auspices and leadership of Madam President, President Preckwinkle of the Cook County Board. And thank you so much, Assistant Secretary Bell Kiwana, for being such a close partner, helping us be a meaningful shareholder in the great, important work of the organizations represented here today and in the larger ecosystem of care to drive home community safety in a world of promising results that we want to continue to build on moving forward. And I want to give a little bit more context for that. Oh, I should also point out, thank you to our hosts, La Rabida, and this beautiful, beautiful space, to leadership of President, could you say? Swice. President Swice, Rolla. So glad that we could continue to hold space because we want to continue to build networking across the organizations supported here. So we are here today to celebrate $25 million in funding being awarded to community organizations under two new initiatives: Cook County Community Violence Intervention and Wraparound Services for Survivors of Gun Violence. So as President Preckwinkle discussed, these investments build off of our historic investments in violence prevention with the Government Alliance for Safe Communities, state, county, city coordination. We are trying to ensure survivors and those most at risk of being lost to ongoing violence can access services and support. I want to take a moment to share a bit about what this support actually looks like. Today, $20 million in funding is going to CVI work, or Community Violence Intervention work. What is CVI? CVI is a model of prevention that engages those most likely to be involved in a shooting. CVI is both evidence-informed and community-affirmed. It is embraced by the research community and those closest to the impact of gun violence. This model, CVI, leverages outreach workers, also known as credible messengers, who make connections on the ground in neighborhoods. Another key feature of CVI is case management, individualized support and referrals to services that meet the unique needs of each person. CVI programs connect people to services like counseling and trauma-informed therapies, legal aid, housing services, and job training and placement. These services, combined with the expertise, understanding, wisdom, and care of outreach workers, case managers, has proven to be an effective formula that is saving lives and disrupting cycles of violence. Our other new, novel grant initiative focuses on survivors of gun violence and their families. We are partnering with incredible organizations like La Rabida that provide services like crisis intervention, clinical care, family therapy, emergency financial support, and housing relocation. And it is significant that we are here today in this beautiful space designed to help youth, children, families heal and thrive. This initiative is built on the foundational belief that healing is essential to ending the gun violence crisis. In designing this grant opportunity, we sought a great deal of community input. We conducted a series of listening sessions in communities that engaged over 100 individuals, including survivors, clinicians, and community stakeholders. The need for holistic, human-centered programming to help survivors heal was a central theme. It is hard to measure the impact of helping a person heal or find stability amid trauma and loss, but the organizations here bring their heart and their understanding of the impact of this work. We know that violence can spread. Exposure and proximity to gun violence is a known risk factor for being lost to violence or incarceration. But guess what else can spread? Just like in this room, hope. Hope is contagious. Your outreach, your work, the organizations gathered here and supported through all these collaborative efforts, it brings people in, it brings people hope. Your advocacy, compassion, and commitment inspires others to get involved in the work, and we can continue to build on the process of healing our communities and helping them be safer, more peaceful, and thriving. So I often have the privilege of meeting outreach workers in these various programs, leading the work, and I can attest to just the courage, the value, the open-heartedness of the folks in the room, and I congratulate everyone here to be a part of the team and to continue to build on this network and show all the great work that you're doing, showcase all the great that you're doing. President Preckwinkle also shared the story of how we got to this place from 2021, our most violent year in recent history. So today, we're building. We are celebrating that we're on a right trend moving forward. We're making sure that there is no wrong door for the people of Cook County or the state of Illinois to walk through to engage in the relationships and the support they need to heal from the tragedy and the challenges that come from exposure to violence and trauma, including gun violence. Thank you everyone here for the work that you do. I'm grateful to celebrate and the continued work and investments of the Government Alliance for Safe Communities, like Assistant Kiwana Bell, Assistant Secretary Bell, and the work of our city partners as well to continue to support this work. Now it is my pleasure to hear more about the work, introducing Teresa Velick, Clinical Director of La Rabida Chicago Child Trauma Center. Teresa?
Thank you, Avik. The La Rabida Chicago Child Trauma Center is thrilled to be able to further address the issue of gun violence. As we all know, gun violence is a public health epidemic, negatively affecting not only those who are killed or injured, but also the individuals and communities who have witnessed gun violence, lost a loved one, or must live with a diminished sense of safety and chronic stress in their communities. Gun violence is particularly impactful for children and youth. Given their physiological, psychological, and psychosocial development, children and youth are especially vulnerable to post-traumatic stress disorder, traumatic grief, anxiety, depression, and externalizing behaviors. That's why we believe it is essential that expert trauma-focused mental health services are accessible in location, setting, cultural responsivity, and cost. The Chicago Child Trauma Center is well situated to address gun violence in an accessible way. With this new funding, we can increase and expand our trauma services that are dedicated specifically to children exposed to gun violence. For kids, like our patient we refer to as X. X is a teenager whose life was forever changed the day he witnessed the tragic shooting and death of one of his closest friends. In the aftermath, he was overwhelmed by grief, troubled by nightmares, and fearful of retaliation. The family was referred to La Rabida's Chicago Child Trauma Center, where a therapist quickly began working with X, utilizing Child and Family Traumatic Stress Intervention, or CFTSI. This short-term treatment helped address his most intense symptoms and provided a sense of stability during a chaotic time. But X's healing journey didn't stop there. With the worst of the trauma stabilized, his family decided to continue therapy. One of the most powerful breakthroughs came through a technique called nightmare rescripting. For weeks, X had been plagued by a recurring dream, facing an intruder and with no way to protect himself. Through therapy, he began to practice how to recognize that he was dreaming and take control. One night, the dream returned, but this time something was different. X realized he was dreaming. Instead of freezing, he imagined himself fighting back, launching fireballs from his hands to stop the intruder. He woke up not in fear, but with a feeling of strength and relief. He felt powerful. As therapy came to a close, X reflected on how far he'd come. He told us, "I never thought I could do this. I used to think therapy was just for crazy people, but it's actually good and helpful. In therapy, he reflected that the shooter, who took the life of his friend, believed that there were only two options: enact violence or be seen as weak. Through therapy, X discovered that he had a third option as he coped and responded to the loss. Now, X shares that lesson with others who feel stuck or hopeless. There's always a third option, he says, a better choice if you look for it. Thank you again for this opportunity to serve children like X and help our communities find those third options. Now, please welcome Yolanda Fields, the Executive Director of Breakthrough.
Thank you, and good morning. I'm Yolanda Fields, the Executive Director of Breakthrough Urban Ministries. Breakthrough does this work in a very comprehensive way in East Garfield Park, where we partner with our neighbors in housing, health and wellness, youth development, and education development. I am excited to be here because this investment means a lot to our community. And so thank you to the Justice Advisory Council. We believe that when we come together collectively, that our impact influences not just our community, but the entire city of Chicago. This investment is important not just because it helps us in community violence intervention, but it is important because it helps us to ensure that our young people are well and prepared for the next level, that everybody has a home, that nobody is hungry, and that we're not just eliminating poverty, but we're building wealth. And so this kind of investment in our communities not only makes a difference, but it creates a different level of playing for community members. About 17 years ago, Breakthrough decided that we would do something different. We decided that we would support our community members who were returning from incarceration, and we have not looked back. I want to introduce to you today somebody who has been with Breakthrough for 17 years. His life, his work, and his impact on our community is making a difference. So I'd like to welcome Damian Morris, the Chief Program Officer of our Violence Prevention Program.
Thank you all so much for being here. Thank you to the Justice Advisory Council for just the investment in us as well. My name is, once again, is Damian Morris. I am the Chief Program Officer of Violence Prevention for Breakthrough Ministries. Breakthrough is honored to receive support from the Justice Advisory Council to support its community violence intervention work that is decreasing incidents of gun violence in our community. With this new grant from the Justice Advisory Council, Breakthrough will be able to build upon a foundation of excellence in the community of violence intervention. We will expand our outreach work and create 24/7 coverage and our response time of 30 minutes within a critical incident, which is one of the best response times and coverages in the city of Chicago. This increased capacity will include more case managers, victim advocates, and street outreach, and who are direct responders to address violence in our neighborhood. Already, we connected dozens of youth to trauma-informed care, job training, as well as safe housing. And we worked hand in hand with our community, schools, faith leaders, and local businesses to create not only safer spaces where our neighborhood can thrive, but also develop the next generation of outreach workers. With 70% of newly hired outreach workers, they came from our participants, our program as participants. When I do this work, I think about relentless engagement and radical hospitality. And so for the sake of privacy, I'm gonna use the name Deshaun. In 2017, when I started out as a case manager, I saw the potential in Deshaun. And Deshaun was a victim of gun violence. And later on, because of that, he ended up being just as involved because he called it a gun charge. But I was determined to reduce his risk level. I saw the potential in him, and I invested not only my time, but I also invested some finances. I invested some development in him. I also developed a relationship with him as well. By me never giving up on what he could be, and so after over 150 weekly engagements with Deshaun, I am now here to tell you that Deshaun is now our team leader as a peacekeeper in our FLIP program. And through my engagement with Deshaun, he has established himself as an independent contractor. He's delivering packages for companies. He haven't been justice involved for over 4 years. And he also have reached the age of 34, in which in his mind, his destiny, he was never going to see the age of 30. As I stand before you, I never forget what he said to me and how he thanked me for always pursuing him, because this changed his destiny. At the rate that he was living, he never thought that he would see the age of 30. Or he thought that he would be in jail for the rest of his life. So thank you, JAC, for your continued investment in our capacity, because it allows us to continue our pursuit of participants like Deshaun in order to produce a better outcome. Year to date, Breakthrough has contributed to a 25% decrease in homicides, a 19% decrease in shootings in Garfield Park, while conducting 116 mediations. Citywide, we are part of a solution that year to date has seen a 41% reduction in shootings. Every life lost is tragic, but this data demonstrates at least a dozen real lives being saved. If we want lasting safety in Garfield Park, we have to continue to invest in people and programs already doing the work. This is not just about reducing crime, but it's also about restoring hope, building trust, and giving our community the tools to heal itself. The Justice Advisory Council is prioritizing these efforts and responding by listening to and equipping communities to heal. So thank you.
Again, I'd like to thank President Swice and La Rabida for hosting us today, and for all of the participants in our press conference. Thank you so much.